What will I do with my patient the second visit during their head and neck cancer treatment? Speech pathologists have a goal at each visit during your treatment. There are clear expectations and guidelines as the body changes with the side effects of the treatment. 84% of you who view this channel do not subscribe, so consider subscribing to our channel. That will help us grow our education and guests. So, it's visit 2 of your patient. You have already seen them for proactive exercises. Now, you want to see that patient around week 2 or week 3 of their radiation. The reason for that is your patient is going to begin to experience some mild side effects at this point in the treatment. Chemo and radiation will each have different side effects depending on the patient and depending on their body. So we can begin to help educate our patients that during this time, they should be able to continue to go through those proactive exercises that we prescribed as therapists, and those exercises are part of our head and neck cancer evaluation. Those exercises ideally should be continued through their treatment until they are not able to do them. Those exercises are highly correlated with decreasing their risks of having a long-term feeding tube. So, visit 2 often looks like hearing your patient, building the rapport, and building the trust. While side effects might not have really kicked in yet, they're going to have some mild concerns and questions related to discomfort swallowing, possibly some initial signs of some tenderness inside the oral cavity, and potentially even some reports of some difficulty with producing saliva at this point, depending on weeks 2 or 3. So, we want to always educate our patients and encourage them of what's to be expected at each stage in their treatment. That's why it's so important to continue to follow them through the course of their treatment.